My name is Heather Himelwright, and I am the president of Integrated Benefit Consultants. And every summer we try and put on a summer series of lunch and learns. And today we're going to talk about long-term care. And I have Joe O here from from OneAmerica, and I can speak from experience that Joe's knows his stuff when it comes to long-term care and what's happening in the marketplace. So we asked him to come on. And One America is also a company that we deal with and we've dealt with for many years. So um, just wanted to go over what long-term care is and actually what's probably going to happen in the state of California with regards to regulations. So with that, I'm going to go ahead and turn it over to Joe.
Yeah, well, thanks a lot, Heather. Thanks for having me here today. And for those joining, thank you. Today what we really want to go over again, as Heather mentioned, is, understanding what long-term care is and talking about the myths versus the facts, the truth about long-term care and some of the changes that are coming in the long-term care industry, especially here in California, and also not just California, but across the country as well. So today's session, as I mentioned, is going to be called The Myths of Long-Term Care. But real quickly, let's just talk about what long-term care is, because a lot of people may have some misconception about what long-term care is. And really, long-term care, what I like to call it, is extended health care. And the reason why I say that is, as we all know, when we say the words long-term care, many of us may think of the things that we don't want to think about, such as a nursing home or wheelchair or those types of events. But what I want to tell you is that really long-term care actually encompasses a wide range of services and support that is out there. There's items such as home health care, adult daycare, just receiving different types of services. Even hospice care is considered long-term care as well. And it's not necessarily just a nursing home event or a stay. And a long-term care event can happen for a short period of time, or just as the name implies, for a long period of time as well. Now, having a long-term care plan in place will give you options and the choice to have the freedom of care that you want to receive. Now, there's several key terms that you need to be aware of when it comes to long-term care. There's what's called a benefit pool, and that is the amount of funds you have available within that long-term care policy to receive services for your care and to pay for that care. There's the benefit period, which is the duration of care that you have available. And then there are activities of daily living, or ADLs. Now, long-term care policies, ours included as well, with every long-term care policy out there, they're not just going to send you out a check without any sort of requirement, and there is going to be some requirements for you to receive those benefits. So what that requirement is that generally speaking, with all long-term care carers, you have to be failing in 2 out of 6 activities of daily living. So these activities include the ability to transfer, which is walking around, getting in and out of bed. There's bathing, there's dressing, there's eating, there's toileting, and there's what's called a continence, which is the ability to hold if you have to use the restroom, but you can't get there in time, you have to be able to hold it in. That's what's all considered activities of daily living. And if my doctor, not the insurance company's doctor, but my own personal doctor says, Joe now needs help with 2 out of 6 activities of daily living, well, now I have triggered the requirement to receive benefits from the policy for long-term care services. And that's going to be required in order to receive these benefits income tax free for us, so that we can use those funds to pay for our care. There's also elimination period. That's the period of time where the insurance company will not pay. So it's like a waiting period. So think of it as a deductible. So you pay your own funds first, you pay your deductible first, and then the insurance company kicks in. Same concept. The elimination period is your deductible. And then you've got inflation riders available where you can add inflation to a policy. And there's also policies out there that allow you to have shared care, meaning you can add 2 people on one policy, such as a husband and wife, or married couple, or legally married spouses, civil unions, domestic partnerships. Those are out there where they'll allow 2 people on one policy to have shared care together. So let's start talking about the facts and the myths that are out there in the marketplace. So we all know that more people will one day need care whether that's at home or nursing facility or residential care facility. And the cost for care is on the rise as well. We've all seen what's going on with inflation. You've probably all felt it in your own life at this point. Heather and I were just talking about the cost of food not too long ago, and I was mentioning long gone are the days where Subway footlongs were only $5. Now you try to get a footlong meal at Subway's, and even that alone is going to set you back maybe 15, 16 bucks, depending on what you're going to get. Shiloh here, who's with us, was talking about getting a bucket of chicken, $45 for a bucket of chicken at KFC. So inflation is on the rise, but most importantly, medical inflation has inflated the most over the past 20-year period. Since 2000 up to this point, medical costs have inflated a whopping 200%. 200% over a 20-year period. So roughly that's about 10% per year, right? But it is on the rise, and the cost is going to rise. And too often people don't actually prepare for their future needs because they're confused about the myths that surround long-term care products and the services. So again, we want to set the record straight, right? So the first myth that we have that comes up the most often is that, well, you know what? We've got each other. Perhaps you and your spouse or another loved one believe that you'll be able to take care of each other one day. The reality is that long-term care situations impact not only the individual, who needs the care, but the entire family. It may impact across generations. Family members who provide care without being paid are the most common source of long-term care help in the U.S. today. Typically speaking, it is the women of the family, such as wives, sisters, or daughters, that step into the caregiving roles, making great personal sacrifices to take on extra responsibilities. But they may not be able to meet every need and be available every hour of the day. So anyone who is considering care for or receiving care from a family member needs to consider these questions. Would you want care? Would you want to care for the family member? Would you trust a family member to care for you? Are you physically and mentally capable of caring for each other? And is caregiving what you really want for each other in your future? Long-term care situations can affect families emotionally and financially, but with the extra help of long-term care protection, a family member can enjoy independence longer, and instead of being a caregiver, they can be the care manager. So let's go on to the next myth. The next most common myth that I hear a lot is that, only old people need long-term care. But here are the facts. Among adults 65 and older, about 70% need some help with basic activities of daily living for weeks, months, or even years as they age. That's 70% of the population, folks. That's not a 70% probability that's going to happen. What this is saying is that among the population, 70% of them needed some help. So it's best to look into long-term care protection services before those services are needed for two main reasons: cost and need. When you're applying for insurance at a younger age, that means policy premiums are lower. And at the same time, it's easier to get approved for a policy or contract at a younger age when health risks are fewer as well. But if you wait to make a purchase, you could potentially pay higher age-based premiums, and you could need more protection, and you risk being declined as well because maybe you've developed a health condition. Now, consider your need, right? Even adults who aren't elderly may need extra assistance from day to day. This can be due to an illness or maybe an injury or chronic condition or some sort of disability. The other myth that I hear very often, some people mistakenly think they don't need separate long-term care protection because they have health insurance, right? Well, the fact is that long-term care insurance is not the same as health insurance. Excuse me. So health insurance is what covers the cost to cure individuals and return them to good health. Health insurance pays for medical care only, but long-term care insurance benefits help support potentially costly long-term care. Now, these include, as I mentioned earlier, bathing, eating, getting dressed, and moving around. Long-term care may be required by people with cognitive impairment that may result from an injury, illness, or just aging as well. Now, the other common myth I hear is that long-term care protection only pays for nursing facility care only. Now, is that right? Not really. That's not right. That's completely wrong because long-term care benefits are designed to help people get the type of care they want when, where, and how they want it. Long-term care protection provides many options in a range of medical, personal, and social services in a variety of settings, such as being at home, in a community, in a residential care facility, or even at a skilled nursing facility as well. But it doesn't cover just skilled nursing facilities. It covers a wide range of topics. So about 80% of care that's provided at home is received from unpaid family caregivers. Many others receive care in a community setting and not in a skilled nursing facility either. Long-term care benefits help expand your choices so that you can receive services when, where, and how they are most needed as well. Now, it takes careful thought and preparation to choose long-term care. So adults really need to consider where they'll want to live as they age and whether their current residence can meet their changing needs as well. Because long-term care protection can help people remain at home longer and avoid the necessity of a nursing facility. So as your health needs become greater, long-term care protection provides access to adult daycare, home care visits, residential care facilities, as well, and many others. So benefits can also include even bed reservation benefits to hold your spot in a facility if you ever need to be hospitalized as well. So long-term care benefits can provide for caregiver training, care coordination, respite care, and hospice care. And like I mentioned, it just covers a wide range of subjects, not just only nursing facility care. It covers a wide range of services. Now, the next thing that I commonly hear is that I can't afford long-term care insurance, right? With all these benefits, you clearly can't afford long-term care insurance. So let's clear up that myth with facts. The cost for long-term care protection can fit nearly anyone's budget and financial goals. If it seems expensive, you need to understand that not having a plan in place can be much, much costlier compared to having a long-term care policy in place. Long-term care costs can quickly deplete a person's hard-earned life savings. So all the years or decades worth of financial planning you may have done can get completely devastated with one single long-term care event. And I'm speaking this from not only from personal experience, but I've been in the industry now for over 15 years. And this is what I typically hear people saying, let's just say that we've got a husband and wife, they're both 60 years old and now the husband needs care. Initially, they may be able to get by all right. They may have saved up some funds aside for a rainy day event such as this one. And generally speaking, they'll be able to get by all right for the first year because initial stages, they may have friends, neighbors, or church communities or other religious communities coming in to provide that volunteer support, and they can get by all right. But generally speaking, within about 6 to 7 months, those volunteers start to fall away, and it is now left on the family members to bear the brunt of that burden of providing the care. And they realize that they need professional help. To provide care on your own has become too difficult. So you need that professional help. And now they're tapping into other assets that may not have been earmarked for this particular event. So they start tapping into assets that were generating other income for them as well. And their entire financial planning gets completely devastated with just one single event. And there's also a wide range of options, funding options that can be used to pay for your long-term care protection as well. If you've got funds sitting in a mutual fund or cash in a bank, or maybe you've got an existing life insurance that has cash value that you no longer need, you can do a 1035 exchange from an existing life insurance or an annuity in some cases as well. Another option is to pay premiums, which are guaranteed never to increase as well over a period of time, such as 10 or 20 years. Now, speaking of ongoing premiums that are guaranteed never to increase, many people may have purchased a traditional long-term care policy in the past 15 to 20 years. And what we're seeing these days is that those traditional long-term care policies are having rate increases over time. We've seen some rate increases anywhere between 30 to 40%, and some as high as over 300%. So these rate increases are happening on traditional long-term care policies, but the benefit of having these other types of policies, there's different types of long-term care policies out there. There's such a policy such as a hybrid policy. They have guarantees that are built into the solution so that the premiums never increase over time, over the years. So you never ever have to worry about having a premium increase. Now, the next common myth that I hear, or the next common thing I hear is that, if you've ever thought you might save up the money you'll need for long-term care, stop to consider two crucial questions. How will I save up the money? And more importantly, why? Long-term care costs can be quite expensive, right? As I mentioned earlier, the cost for medical care has increased a whopping 200% over the last 20-year period. The growing cost for care presents a huge financial risk to any older adults in their retirement savings. Those who plan to pay out of pocket for long-term care expenses could quickly deplete their lifetime savings. So we need to consider the following facts. The average cost for a 1-year stay in a private nursing facility room, the average cost is $83,580. That's just for 1 year, right? But of all Americans age 65 and up, 1 in 5 will require long-term care for 5 years or more. 5 years or more. And at today's average cost, a couple with a $500,000 in assets could deplete their savings in just a few short years of paying for long-term care. Now, the last one that I commonly hear is, you know what? I'm not going to worry. The government's going to take care of me. Uncle Sam is going to take care of me. Now, if you mistakenly believe that a government program will take care of you, well, we need to take a look at some of the following facts. We need to remember that government programs are difficult to qualify for, and they have very specific requirements for long-term care. Now, a number of public programs like Medicare and Medicaid, or Medi-Cal here in California, or Veteran Services, may help pay for some long-term care in certain circumstances, but each program has specific rules that define which services are covered, when benefits are paid, and how you qualify, and the dollar amount participants must pay on their own. And the most important thing to remember is that government programs are limited by availability and financial resources as well. And financial resources is the biggest stumbling block for governments when it comes to providing care through the state's Medicaid or Medi-Cal program, and even Medicare. As a matter of fact, back in the 90s, Medicare did used to cover for long-term care nursing home stays, but not anymore. That stopped back in the 90s. And currently, it is on the state's budget to provide funding for the state's Medicaid or Medi-Cal program here in California. And most states have to work with a fixed budget. It's not like states can go out and print more money. They're not allowed to do that. So they have to work with the budget that they've got. But the biggest expense for any state is their Medicaid or Medi-Cal program. And within the Medi-Cal program here in California, the biggest expense in the Medi-Cal program itself is for long-term care support services. And other states are now seeing this as well, and they're trying to do some crazy things to try to resolve this. So let me give you an example of what's going on in the country right now. In Washington state, a couple of years ago, what they said was, we're having issues with our Medicaid program to provide funding for long-term care services for our older population. So we need to try to resolve this. And what they came up with was a state-funded long-term care program. So they said, what we're going to do is we're going to charge every employee in the state of Washington that are W-2 employees, we're going to add an additional payroll deduction to the tune of 0.58%. And these employees will be funding into a state-funded long-term care program so that we can provide services to our citizens in the state of Washington. Now, what that 0.58% got you was a lifetime benefit from the state of Washington of $36,500, $100 per day per limit. And that was going to provide coverage for only 1 year of care. But we do realize that we're going to need more than 1 year of care. So that just absolutely doesn't cut it. It doesn't provide the absolute coverage that we need when it comes to long-term care services. But what they also said in Washington was that if you have your own private long-term care policy before November 1st of 2021, then we will go ahead and give you an exemption from having to pay these additional taxes on your payroll. So what people in Washington did was they started flooding the long-term care marketplace because they all wanted to avoid this extra taxation. And of course, no one wants to pay extra taxes. So I don't blame people that try to flood the marketplace to buy additional policies. But that's what they did. They all fled the marketplace, and Washington quickly realized, well, this wasn't that great for us. We now didn't get the funding that we were looking at, but we're still going to do this anyway, though. We're still going to push this through. So anyone who doesn't have a solution in place before November 1st of 2021, they're now going to have to pay additional funds out of their payroll to fund the state-funded long-term care program. That's 0.58% on every dollar earned. That's 58 cents for every $100 that you've earned. Now, Washington is just the tip of the iceberg, folks. There are 19 states, including the state of Washington, that are trying to consider some sort of state-mandated long-term care program, and California is the very next one. We're on the cusp of having a state-funded long-term care program here in California. So what they are doing right now is they have formed what's called a California Long-Term Care Task Force, and they are looking at the feasibility and how feasible it is to have a state-funded long-term care program, and it is coming very close to being in fruition. So what they're proposing is a state-funded program that's going to go into effect potentially on January 1st of 2025. But what California is also saying is that if you have your own private long-term care policy before a certain exemption deadline, then California will go ahead and provide you an exemption from having to pay into these taxes. Now, as far as that exemption deadline is concerned, what California is trying to do is they don't want the same thing that happened in Washington, because they want to capture as many people to fund into this program. So they are suggesting a retroactive deadline. So what they want is a deadline of January 1st, the year prior to whenever this bill is either passed or signed by the governor, for you to have your own private policy in place so that you can apply for an exemption or at least have reduced tax rates. Now, what your private policy minimums will need to look like, we don't know exactly what that's going to be like. They haven't stated exactly as far as, oh, you need to have a certain benefit amount for you to be exempt. They haven't gone over those criteria just yet. They're still in the designing phases. But what they're considering right now is a tax rate, a income tax rate of anywhere between 0.4 to 0.6% on all income. So that's different from the state of Washington. Washington said that we're going to have a payroll deduction for all W-2 employees, but in California, what they're wanting to implement is an income tax. So even if you're on 1099, you will be taxed on this because it is an income tax. If you're already retired and you don't have income from an employment, but you're still taking money out of your 401k or your IRAs or your SEP IRAs, whatever you may have, your pension plans, as long as reported as income, you will be taxed on the money if you don't have a plan in place. And again, right now, that deadline is looking more and more likely to be January 1st of 2024 for you to have a plan in place in order to get an exemption. Now, what California is considering offering in terms of benefits on the state-funded long-term care program is they're looking at providing a lifetime benefit of $36,000 in the state of California. The state of California is looking to offer $36,000, and we saw the average cost of care earlier. We saw that it was about $85,000 for a private nursing facility. So we know that $36,000 absolutely will not cut it here in California either. But that's what they are considering at this time. And I always tell people, get a plan in place now, have a plan in place now while you still have options available. Because what happened in Washington was that when people started flooding the marketplace to get their own policy to apply for an exemption, while insurance carriers started slowly, one by one, they started pulling out of the market and said, we're no longer going to do any business in Washington because we just cannot handle all this volume of business that is coming in. So at the end of the day, many people were losing out on the options that were available to them. If you get ahead of this now and you start putting a plan in place today before the rush happens later on, you have tons of options available for you today. Whereas the longer you wait, you may not have all the options available. And to even go through underwriting and have the case approved and issued for you may take quite a long time. Instead of taking a week or two, maybe it ends up taking 2, 3, or even 6 months, depending on with the carrier that you're working with. So it is imperative that you start working today to have a plan in place. Another thing that's going to be different in California, as I mentioned, not only is it going to be an income tax in California, in Washington, this was a tax only on employees in the state of Washington. But in California, what they're considering is a split tax between employer and employee. What that split will be like, we don't know just yet. They're still designing that. They're still designing that number and coming to a final number soon. We don't know. Hopefully, in a couple months, we'll know what those numbers are. But they haven't announced any final numbers yet. But we can safely assume that it may be somewhere around a 50-50 line, or 30-70 or 60-40, along those lines, as far as split is concerned. So employers will also be taxed as well if their employees don't have a long-term care plan in place. So if for those of you that may be a business owner and you've got key employees, you may want to look at considering offering long-term care for your key employees as well. Right? So just get into the place today. Get going today. Have a plan in place today. Start working with Heather and her team to have a plan in place today. Right? Heather, anything else you want to add to that?
You did a great job.
Thank you.
Wonderful job. No, I mean, the thing is that what I perceive our job to be is to put the information in front of our clients, and at least you guys know what's coming down the road, and you can help your clients prepare for it, yourself prepare for it, family. Long-term care is an amazing product and has changed tremendously over the years. So if you are considering doing it, and what Joe alluded to is there are very few carriers in the state of California anyway. So, we've got the pick of all of them, but as things go forward, it's very likely that most, if not all, will leave the marketplace. Now, if you had a plan, that's great. It's yours. You've got it. But we just wanted to put this information in front of you. We appreciate your time very, very much. And thank you, Joe. Really appreciate it.
You're welcome. Thanks for having me.
Does anybody have any questions? Well, actually, I have a question.
Yeah.
So, on this particular, you mentioned an employer putting the plan together and an employer paying for it. Can the employer take a deduction for those?
Absolutely. There are tax deductions available for employers as well if they put a plan in place for their employees.
Now, does it have to depend on the corporation, like an S Corp, C Corp?
There are, yes. There are. It is dependent on what type of corporation or what type of business it may be. If you're a C corporation, you can deduct 100% of any long-term care costs, true long-term care costs. So really it depends on the product, on the type of product, on how much you may be able to deduct, depending on the product. If you're an LLC or an S corporation, it depends on the age of the insured as well, on how much you can deduct.
Right. Okay. Thank you.
You're welcome.
So wanted to let everybody know that, as I mentioned before, that we try and do a series of lunch and learns during the summer. And our next topic is going to be insurance. It's basically an insurance guide for the digital nomad. And what that means is that obviously in this environment, people are all over the place. People have moved from California to Wyoming to wherever. So, that creates an insurance issue. So we really wanted to touch upon that and give solutions. So, and then we're going to discuss Medicare and cannabis in the health industry, because that is definitely something that's growing, especially in California. So, but if anybody comes up with any questions, you can obviously email, text, call, let us know. But we recorded this and we'll send it out.